Hi everyone, in this video we are going to discuss which is the best type of tooth wear to treat. Although we cannot be choosers, so we cannot choose what type of tooth wear walks into our practice, but we need to have some idea what type of tooth wear is easy to treat so we can predict our results. So with regards to tooth wear, there are two types of tooth wears. You have a physical causes and you have chemical causes. In physical causes you have attrition, which is teeth versus teeth, or abrasion, which is teeth versus abrasive material. It could be toothbrush or it could be something else. In chemical, you have erosion, you have perimyelitis, and you have abfraction. We all are aware of these terminologies, and I'm not going to go into controversies between abfraction and why this happens and perimyelitis, but you need to just understand the differences between physical causes and chemical causes. So if you look at these two cases, on your left you have patient who has broken down teeth, wear, and on the right side also patient has wear and some of the teeth which are broken down. Now between these two cases you can clearly see the left side case is because of the attrition, or mainly because of the attrition, and the right side of the case is mainly because of chemical erosion. And because of that, we know that if patient has a parafunctional habit, they are always going to have that parafunctional habit, or it can get activated anytime. And because of that, we know that those are the patients are very difficult to treat because of their muscles of mastication. They have, you need to deprogram their muscle. They might have muscle issues. Whereas patient who has erosive wear, they are much more easier to treat. In my clinical practice, I mean, you can treat both of them predictably. But if I say which type of wear you could, if you haven't done any full mouth reconstruction, which type of wear you can start, then erosive wear is safer to start the treatment than attritive wear, like on the left side. Of course, if patient doesn't have any restoration and just attrition, then it becomes slightly easier, because worst case scenario, if you're using adhesive technique, then your restoration will break. You're not going to have catastrophic damage to the original teeth. But again, it is not ideal to keep having restorations breaking again and again and again. So make sure that you have gained enough experience in treating minor wear cases first before you indulge into cases such as on your left hand side, which is more complex case. However, again, if you start with adhesive technique or full mouth reconstruction, you can get away with a lot of issues because it's much easier to treat. But that doesn't compensate the fact that you need to have a knowledge, and you need to have a structured course, and you need to have structured teaching and learning in order to learn about full mouth reconstruction. So again, to top 3 tips, if you're going to pick, and if you have option to pick cases, then pick erosive case. One patient, if you're doing case who had bruxism, don't say no to them, but one patient that they will never stop bruxing, they will never stop grinding their teeth, and warn them about the failure from the beginning. And make sure you provide occlusal appliances such as Michigan splint after you finish treatment for those patients. So I hope you found this video useful. If you have, please share with your colleagues and friends. If you have any questions, please contact me on social media or go to my website www.drdevangpatel.com.